everybody. My name is Rebecca Scroggy. I am a registered nurse and an IBCLC, but probably most importantly, I am a mom to two kids. I am so beyond thrilled to be here with you and share some amazing superstar interviews with you all. We will be going over amazing topics like lactation, postpartum mental health, pelvic floor, and so much more. Just to make sure you don't miss anything, make sure to hit subscribe and follow us on all of our socials. We'll link them below. And as always, we want to know what you want to hear. So comment below any topics that you'd like us to cover. So now that we got that over with, here we go. I am so excited to have you, Brienne. I've heard nothing but good things about you, and I love all the content that you provide on Instagram. I'm just so excited to have you here.
Thank you so much. I can't wait to talk about this topic.
Yes. So today we're going to be talking about intimacy and pelvic floor health, and I'd really love to talk with you about that in like the pelvic floor, aspect, because we know that there's a lot of hormones that can affect people mentally, but there's also that whole physical aspect that for some reason society has just deemed as not an important aspect of that postpartum experience. So if you want to introduce yourself and just kind of tell me a little bit about you and your practice and why did you decide to work with pelvic floor? Was it the vaginas? Like, what was it?
Well, I didn't start out working with pelvic health at all. I actually started out in geriatric care, and there's so many threads I could pull, but one just quick thread is how many folks in geriatric care would not be able to return home to their independent living because of incontinence. And because of that, they had to, find an alternative, maybe stay in the skilled nursing facility or, find a different option. And it was hard on the patients, on the families. And that really it hit home. And then I became pregnant with my son, who's now turning 18, if you can believe this.
That's crazy.
So I've been in the field for a long time, but when I got pregnant, I just became really fascinated with pelvic health because obviously, my own issues that I was going through. I also was looking for a career change because honestly, I think geriatrics wasn't the right fit for me straight out of physical therapy school. So I did make that switch, did the coursework I needed to specialize because honestly, even in physical therapy school where our whole focus is anatomy and the human body, 20 some years ago, the pelvic floor wasn't a huge part of the curriculum. It was really just kind of glossed over, knowing that if you wanted to specialize in it, you would take the extra coursework, which I did. But I still think that's kind of shocking that just basic in high school should be covering the pelvic floor. And it's really quite sad when a doctoral level program, again, this is me speaking of a program 20 years ago, but still it really wasn't highlighting pelvic floor as much as I think it should. It's a keystone. This part of our body is a key connecting point of so many different areas. It's the middle of it all. And there's no hierarchy of muscles that are important, but the pelvic floor is extremely important. It is the center of everything. It's the floor of our core. It is what houses our vital reproductive organs. It what helps us poop and pee. I mean, we need this part of our body to be strong and no one talks about it.
It's almost like the foundation of a house, like the way you described that. It really makes me think of, that foundation of the house. And if there's cracks in that foundation, that causes issues with the whole entire house, not just, the bottom layer. That's really, really interesting. So why do you think that people aren't talking about this? Why is this not part of curriculums of the pelvic floor?
Well, I mean, there's so many things, again, lots of threads that I could go here, but I mean, typically we tend to talk about things that people have problems with, and typically the people who have problems with their pelvic floor are women after having children, not always before childbirth, although I want to make this really clear, every human has a pelvic floor. Every human can have pelvic floor problems. No matter whether you've been pregnant or not, you can have pelvic floor problems. But needless to say, many problems develop after pregnancy or during or after pregnancy, and also, into menopause. And if we look at who is studied in research, it's not women. It's not women, and it's certainly not pregnant women or women in menopause. It's a very discarded section of society, unfortunately. And so if people aren't studying it, it's not going to be in the medical field. It's not
Yeah.
going to be in our training programs. It's not going to be talked about. And that's a shame.
Yeah, yeah, absolutely. And I feel like also just growing up, I always heard from people that it was just common that you were going to have like leakage problems and, XYZ after having babies. Like it's just part of having babies. And I love that, just in the past couple of years, I've seen this really big push for more education about pelvic floor and like, what's normal, what's not normal, when to seek out help and stuff. So I love that you have that experience.
Yeah, and it is becoming a lot more. Well, first of all, those issues that you speak of, the bladder leakage, the various things people deal with, very common, 100% common, yes, but normal, they don't have to be, so they're common, but they're not normal. And we've normalized it and just brushed it off as, well, it's just what happens. But the thing is, there's hope and there's help. And so that's part one of it. The other part is, yes, awareness is growing, thank goodness. And there's so many more wonderful pelvic floor PTs that are creating platforms for themselves and really sharing information and spreading the word. But it's still not enough.
Yeah.
And in other countries, like I lived in Germany for 12 years and I wasn't part of, like, I didn't participate as a client in their healthcare system, but I knew from talking with other people, my neighbors in Germany, that it was just standard that women at least were given the option to go to group pelvic floor focused sessions after having babies. Like it was covered in their healthcare. It was normal. And that is not something that is yet happening in the United States. And I really hope that changes.
Yeah, absolutely. What is the pelvic floor? I know we talked about it being the foundation of the house, but like, how do you describe it to a patient? Like, this is your pelvic floor and this is what it looks like and how it works.
Yeah. Well, I have my model because I love my pelvic floor model. And
I love that.
Hopefully anyone watching can see this. It is, the pelvic floor is a group of muscles. It's not just one muscle, but it's a group of muscles at the base of your pelvis. So this is your bony pelvis when you put your hands on your hips. That's what we call, we call these iliac crests, our hips, even though our hips are actually down low. But when you put your hands on your pelvis, down in that bowl at the bottom of the bowl is this hammock of muscles. And there's inner muscles and there's outer muscles and there's a bunch of different muscles that combine along with layers of fascia to create the pelvic floor structure, which this is a structure that if you think about contracting it, it's always low level on, like it's always there as part of our stability and postural system. But if you want to contract it a little extra, that would be where you do what is typically called a Kegel. People have heard Kegels, even though a lot of people are doing Kegels wrong. But that's another story. People are doing Kegels incorrectly. They're actually bearing down or they're squeezing their belly instead of their pelvic floor muscles. But what it should feel like is like you're plucking a blueberry up off the ground into your vagina or your anus, and then you are setting it down. And that's the most important part with your Kegel exercise is you're not just squeezing and lifting those pelvic floor muscles, you're also relaxing them and letting them go. Because so many people who do Kegels on well-meaning advice from people or media, they do like 100 Kegels a day or, every hour they're doing Kegels, but they're either doing them wrong or they're just doing the squeeze and they're not relaxing. And that's like doing a bicep curl, but never actually letting your bicep muscle go. And so you're not gaining strength, you're just gaining tension. And tension is not strong. It's actually quite weak.
Wow, that's really interesting. I've always heard it's like zipping up your jeans too, of like you start at the bottom and like pull up, but I've never heard of like the relaxing. That's really interesting too.
Yes. And the zipping up cue is really helpful because that brings upon a point that's really important to make, which is that the pelvic floor is just part of a system. And really there's not a whole, it can be helpful to work the pelvic floor in isolation with Kegels, which that's what this is an isolation exercise where you're really just working that group of pelvic floor muscles. But really the pelvic floor is meant to work as a team with the muscles above and below it too. So our hip muscles, our glutes, and our abdominals and our breathing diaphragm, like they're all connected. And so what you said about zipping up is something, it's a cue that I use in a lot of my exercise videos on YouTube where I'm having people zip up their core. So the idea is they start with the low core, like the pelvic floor and those deep low abs, like they're zipping up a zipper from way down low all the way up to their ribs. And that is activating the entire core. And you can keep that gentle core activation while you're doing some exercises to help keep your core stability. But even then, when you're done with the reps or sets of that exercise, you need to let it go because the last thing you need is more people walking around with tense, tight muscles all day. It's not good.
So true.
Like, stop
So
sucking it
true.
in.
So like, you talked about the tension. Could that cause issues? Like
Yes.
what are kind of like some of the symptoms that come with pelvic floor issues? I know you were talking about the leaking. I've heard some other things, but I mean, like, is there some that you see a lot in your practice?
I know I don't make blanket statements. I really
Mhm.
try to avoid blanket
Yeah.
statements, but I would say a majority, definitely, of the issues I see across the range of ages and types of people is pelvic tension. And the tension can cause the same issues that weakness. We may think of like bladder leakage as like weakness or like loose, like saggy, for lack of a better term, like pelvic floor muscles. But oftentimes it's actually tension that can also cause bladder leakage because, again, you have a bicep muscle that's constantly tight. It's not actually able to pick up the apple and bring it to your mouth. It's so tight and tense, it can't do its job. And so the pelvic floor, which one of their jobs, of course, is stability of the core, posture, but also continence and keeping in and letting out at appropriate times your poop and your pee. And so you can have bladder leakage from too much tension. One thing that can signify possibly, it's just a possible thought that maybe there's too much tension is that feeling of like, I've always got to go. My bladder's the size of an acorn. Like if you have that frequency issue building up, there's a sensitivity developing in your bladder to the sensation of your bladder filling. It's kind of a brain body thing, but it's also potentially from muscles that are real tight. And it's just kind of aggravating and amping up sensation in that whole area. So I also see people with prolapse, which is when your pelvic organs shift and they, descend out of place. They kind of bulge into the vaginal wall, or the uterus actually shifts downwards. So that also can make prolapse can feel worse when there's too much tension, which is very common in people with prolapse because the person is trying to keep everything in. They're like, my bladder is falling, my uterus is falling. I feel this heaviness. So I better tense up my muscles to keep everything in. But that actually then makes your symptoms feel worse because of all that tension.
Yeah. Yeah. So I also know that sometimes pelvic floor, like that tension can cause issues with intimacy and like sex, especially after having a baby. Is that something that you've also seen in your practice of being an issue?
Yeah, definitely. And I mean, one reason there's so many reasons for that specifically related to pregnancy though, because yes, painful sex is actually so common amongst all women and sexual difficulties among all genders that can be related to pelvic floor, but specifically to postpartum. One thing that happens is our hormones are all, different.
Very much so.
Estrogen is lower after pregnancy while you're breastfeeding. Estrogen is one of the hormones that changes and it's lower. And when that happens, that can contribute to vaginal dryness and really things not feeling great down there during sex. And so when you have sex and it hurts because it's dry, or it just feels different than before, then your muscles are going to reflexively protect you by tensing up and bracing, which is going to make the sex hurt even more. So it's like this vicious cycle, really.
Yeah. Oh, that's so terrible. So after giving birth, are there any like safe exercises? I know you're talking about the Kegels or Kegels of like how to do them correctly. Are there any things that you recommend, right after birth that maybe moms can start on or people can start on to kind of help maybe, I don't want to say prevent pelvic floor issues, but like maybe help with them?
Yeah, for sure. And actually, one thing that I remember from my own childbirth experience 18 years ago, which I fully admit that everybody's experience is different and maybe people won't resonate with this, but for me, I knew I was studying pelvic health. I was studying pelvic floor. So I was really aware of like, I got to get back on it. I want to get back on my Kegels. I want to get back on activating my core as soon as possible. But I couldn't feel anything. It was complete disconnect for quite a while. And I don't remember exactly like what week or month things truly came back online, but I'd say it was within a few weeks that I started really being able to feel. But just don't be alarmed if you don't right away feel much in your abdominals. Most people have rectus diastasis recti. We've got the separation, we've got this traumatic experience that just happened in your pelvic
Mhm.
floor. I mean, it's a
Yeah.
big deal. And
Yeah.
so it takes a while for the muscles to regain sensation. So one of the best early exercises anybody can do starting right away is just breathing, which
Mm.
we're all breathing anyway, but the
Yeah.
pelvic floor is intimately involved in breathing. And so even if you can't really sense it, just knowing that if you are breathing fully and expansively, not up high in your neck and like upper chest, but if you're trying to bring your breath down low around your rib cage into your back body, that is naturally exercising your breathing diaphragm, which is the top of the core. And when the breathing diaphragm goes up and down, it impacts what's happening at your pelvic floor too. So it's just a
Mhm.
really beautiful way to kind of automatically mobilize the abdominals, the pelvic floor muscles by just breathing properly. Like that's all you have to do.
That's pretty easy to do, actually. I mean, like,
Yeah.
I mean, it sounds like so basic, though. I love that.
Yeah. Another really easy starter exercise, especially if you're not feeling those Kegels right away, because again, Kegels are a mixed bag. So for some
Yeah.
people, they can actually be inappropriate, especially if they're not doing them correctly or if they have too much tension. But another great and wonderful healing exercise for when your body feels ready, and everyone's different here, but
Yeah.
would be hip circles, like doing some
Mm.
standing hip circles, even when you're holding your baby or just brushing your teeth at night, just circling your hips around like you're drawing a circle on the ground beneath you 5 to 10 times in each direction. It's just warming up all of those muscles that are all connected in this
Yeah.
region with the pelvic floor at the middle.
That's such a great idea. I love how you said when you were holding your baby, because that's such, I mean, everyone like is standing and holding their baby at some point. So
Right.
that's a really easy one to do. So is there a time frame of when they should start pelvic floor rehab? So like say, I mean, I would think also how you push your baby out could impact your pelvic floor because, I've heard different nurses say, push like you're pooping, push like as you breathe and all that good stuff. So like, can that impact it? And if so, when should you start pelvic floor therapy?
Yeah, definitely. I mean, your mode of delivery is very impactful on your pelvic health. So, for example, forceps delivery for those who have to have that as an option that's needed, of
Yeah.
course, but that oftentimes can potentially contribute to more issues down the road in the pelvic
Mhm.
area. So, that's one that may contribute. Cesarean section doesn't necessarily mean that you won't have something such as prolapse, for example. A lot of people think, well, if I'm not pushing the baby out vaginally, and I have a C-section, then I won't have prolapse. But that's not necessarily the case. There may be
Yeah.
less of a risk, but it's not necessarily. There's lots of basically any mode of delivery is going to have its risks and
Yeah.
its trauma to the body, a good trauma, thank goodness, because we have a baby out of it. But
Yeah.
like it is an event for the
Yeah.
body. And so my suggestion is to see a pelvic floor physical therapist as early as you can. And
Okay.
it's going to be really a conversation with the PT about what they can help you with, but knowing that a lot can change naturally too. So within the first 6 weeks or so, a lot of women who present with prolapse may not actually see that prolapse. It may not actually be an issue that's a problem for them after 6 to 8 weeks. So you might want to wait till like, I don't know, 8 to 10 weeks postpartum to see a PT to kind of get things a little bit stabilized after the initial event of childbirth, but early enough so that you can get some really great education and some, great just sort of kickstart tools to get yourself back on track.
Yeah.
And on that same thread is there's new guidelines that just came out, 2025 guidelines. They're from Canada, but they have guidelines about people who get back into physical activity. 120 minutes a week was recommended of moderate to vigorous physical activity based on your specific needs, because everybody's different. So it's not saying to get back to running necessarily, like your body has to be ready for it, but some type of moderate physical activity, 120 minutes a week divided up into 4 times a week ish, like 30 minutes a day, 4 times a week. That and early pelvic floor physical therapy, both of those things have really been proven to be effective through this huge systematic review of studies to be extremely, extremely effective for sleep quality and for mental health and for physical health and healing and reduction in pelvic floor concerns down the road. So essentially start early, like yes, rest, get support, get help. There is a 4th trimester, like you need somebody to help you. You can't do it all. Can't do what I did, which is for a run 3 weeks postpartum and developed prolapse. Like I did that.
Terrible.
It was horrible. After baking like 3 apple pies, I don't know what I was thinking. I was stressed and I was trying to cope and I coped wrong and it hurt my body. And so it's not saying that, but it is saying to don't diminish the impact, the positive impact of exercise when done at your body's level in a gradually progressive way, with starting within that first 12 weeks.
That's really interesting. You're a whole different person after you have a baby. And so what are some common changes that you might have seen as a therapist with like intimacy for couples after having birth?
Yeah. I mean, what I really see and what I also remember for myself is that really common thing of just feeling different, feeling your body has changed. My body has changed. Things are different. Things feel different, things look different. And so you're mentally dealing with all of that. And that's even if you don't have a pelvic floor injury or like, prolapse that's persisted or some other issue. Even if you haven't had that, you're still different, you're still changed, and you're not broken, but you are changed. There's a difference. And so that needs to be acknowledged, and just helping a woman in some cases grieve through that process, this grief process of like, things are different than they used to be. And that's okay. I mean, however you get there, usually ultimately we're getting to a level of acceptance of the new normal and working with it and, seeing how we can optimize the new normal. So that's one side, just working with the individual person on the changes. But as a couple, what I see and what I remember experiencing is you're so exhausted. You're doing crazy things like going on a run and baking 3 pies that don't make any sense. And you're having emotional, outbursts and whatever. And so I think I know that it can feel really, really challenging to be overwhelmed, to be in this warrior. Like we think of childbirth and postpartum as such a soft feminine energy time, but it's really a time when your inner warrior comes out. It is 100%. A warrior time. Like your job is to protect this little being. And so it is fierce and it is power. And it is, in a way, if you're thinking of the duality of masculine, feminine energy, it's quite masculine energy, you know? And so if you have another demand on your time and energy, meaning your partner is sometimes felt like a demand on your time and energy, it's just too much, and it can make you not be interested at all in intimacy, and it can create tension in the relationship for sure. And so I just think honoring that you've got a lot going on, and really what you need from your partner is support. You really, in a way, need them. This is me. I'm not a psychologist, but I just want to say from a personal experience and some things I've shared with clients and talked about with clients and friends is I'm really grateful that my partner did take on a supportive role. He really took on quite a feminine energy role in our relationship for a long period of time. And I'm so grateful for that, because it allowed me to be my protector mama bear. And it allowed me to have that like structure that I was trying to create for our new family, to go through all of my emotional things while he just supported me and he never pushed me. And so I really am grateful for that every day. And I know not everyone has that benefit, but I just think the more you can be open and share your needs kindly with your partner about what you need, that's helpful. And then giving yourself some self-nurturance and self-connection can go a long way too. I mean, just literally like cupping your vulva is so healing, not for pleasure, not for, whatever, if that happens, that's fine. But literally just holding your body, you holding your body for you, not for anybody else, is magic.
Yeah. I love that key of just trying to reconnect with yourself can really impact that intimacy with your partner and help with that too. And holding something that's yours, that's just yours. That's such a great point.
No expectations, no outcomes, just comforting. I mean, little kids comfort themselves by holding their privates, and we've gotten out of that because it's, quote, socially inappropriate, socially inappropriate. And of course you don't want to necessarily go do that at the grocery store, but I mean, or you could, but let's change that, right? But but I mean, just in the comfort, even just falling asleep at night, just holding your own body we always hear it starts with you. It starts with you. It starts with you. And there's truth to that statement. We hear it over and over because it's true. So
yeah. And I tell people too, if like, because I love that. That's such a kinetic, like physical way of connecting with your body. And if you are more of like an auditory learner, I usually tell people like stand in front of a mirror and tell yourself verbally, thank you. Like, thank you, stomach, for holding my baby. Thank you, pelvic floor, for helping my baby come out. Thank you to my breast for just verbalizing that can sometimes be a really healing way too of reconnecting with your body.
Again, we do change. I'm going through it now as I enter menopause, and it's just something that happens. And you look in the mirror and you're like, what's happening? Like, this is another. So just like going through this journey after pregnancy and learning to just accept and love yourself exactly as you are can help for the future too.
And I feel like a lot of times too, when I'm talking to moms that, you know, might be like around my age range or maybe even a little bit younger, they were raised by moms and we were raised in a society where there was this bounce back culture and you have to look a certain way. And now as adults, we're like, okay, that's wrong. And so it's a lot of unlearning so that we're not passing that along to our own children. Like my second, I love how you said that you get your warrior like energy, because with my second, I totally felt that. Like I did no epidural or anything. And so I came out of that and I looked at my partner and I was like, I feel like an absolute badass. Like, I don't know if I should say that on YouTube or not, but I did. And I was like, I feel like I could like go hunt a bear down right now. Like
totally.
This is, you know,
like a warrior goddess. It's amazing.
Yeah.
I was the same. I also didn't have, I chose to do it naturally. And you do. It's powerful. It's powerful.
Yeah. I was like, wow, that was crazy, a crazy impactful event for me. And I love that you kind of talked about how that change, you know, really does impact everything.
Totally. It's like your warrior self a rest. I mean, even a warrior needs to like rest, put down the shield and the sword and like take a break every once in a while, or they're going to burn out and not feel good. When I gave those guidelines about exercise, I don't want to ever imply to anyone that we're doing it in order to bounce back or like look a certain way or lose the baby weight on a certain timeline. It's really all about mental health and sleep quality. Which when you have mental health and sleep quality in line, that is also going to help with your intimate life. You're going to feel more open to relationships, to sex with your partner, to intimacy with your partner, if you are just feeling better and more vibrant physically. So it's not about how you look. It's about how you feel.
And I love how you said that, like, because, you know, babies don't sleep. I don't know who came up with the term that like sleep like a baby, because that's not a thing. I would rather sleep like a teenager where they get to sleep for 12 hours straight. That's the kind of sleep that I want. A baby wakes up usually about every 2 to 3 hours. So that is not a good sleep.
You are so right. Sleep like a baby is BS. We don't want to do that.
Who came up with that? It must have been a man or something. No shade to men, but it definitely had to have been a man that came up with that saying, because it definitely wasn't the woman staring at their partner with their useless nipples being like, yeah, the baby slept great last night. That is definitely not that. Life is already stressful enough. We don't need to add sleep deprivation on top of that.
Right. Well, and I'll just add one more little pelvic floor thing is that our stress levels directly impact the pelvic floor. So the pelvic floor muscles are one of the first and fastest groups of muscles in the body to activate when we're feeling anxious, threatened, or stressed. So if you're already like amped up from new motherhood and maybe you have a couple of kids at home and it's just like life is lifing hard and you're stressed, then naturally your body is going to tighten and tense. And the pelvic floor is a significant muscle group that tenses and tightens really strongly. Like we all know we get knots in our shoulders and we need to go get a massage, but it's happening in your pelvic floor too. So that's another reason to focus on gently, gradually getting that exercise and that good sleep so that you're managing your stress, managing your mental health, and your muscles and your body can be working optimally and not tight and tense. And then you're going to feel like having better sex.
And everyone needs that. Everyone needs. One thing that I like that you talked about with that of like, the better sex. And this is so embarrassing, but it's not embarrassing. I have no such thing as a TMI. I don't know why I said it's embarrassing. So like one thing that I saw after I had my first was something called chore play that partners can do. You know exactly what I'm talking about. So, like we all heard of the term foreplay, where it just like kind of helps like, ramp things up sexually, but chore play is like before that even happens. And it's where your partner goes, hey babe, I'm going to load the dishwasher. Do you have any dishes you want me to put in there? Like, oh, I see that I can smell the toddler needs to be changed. I'm going to go ahead and change the diaper. And, as women, we're like, okay, okay.
Exactly.
Okay. So like,
good.
I love
Yes.
that.
Yes. So good. And
Yeah.
so true. So true. I'm
Yeah.
definitely turned on by chore play.
Yes. I mean, there's something like really sexy about the fact that you just come in a room and it's like clean. You don't have to worry about it. And like that talks about what you were talking about with the mental health of, when you're all tight and tense, you can't relax. And, mess adds to that stress. Your to-do list adds to that stress. And when you're laying in bed trying to get it on and all you can think of is, I need to check. That's hard.
Right. Which then feeds into going back to that study, like what we were talking about. One really cool thing you're going to love if you read this article.
Oh, I'm so excited. Yeah,
you're going to love this. Even just in the little bullet point, key point takeaways is it talks about the fact that the reality of new motherhood and life with little kids is crazy. And don't stress if you don't get it perfect. Don't stress if it's unreasonable to reach these particular guidelines or to reach a certain level of perfect sex life or perfect whatever. Like, just know that you're doing the best you can. I mean, really, that is so, that's like an aphrodisiac in itself, just relaxing into what is instead of trying so hard to be some perfect anything. There's no such thing as perfect.
Yeah, no, I love that. And like and you said this too, of like, how the sex can change, and that's okay too. I mean, you're a whole new person after giving birth, and honestly, your partner is a whole new person. They either witnessed it or they're, also in charge now of this new little person that depends on everything for them. And then that, that masculine energy of protection of now you feel like you have two people you need to protect. And so that changes a lot too, for sure. Is there anything else that you suggest for partners to do during this transition of like, especially when your mom is like, I don't even recognize my body. Like, I don't know what to even, like, I don't feel like I can even have sex with you without a shirt on because I don't know what's going on.
I mean, I just believe so strongly in every couple is different in their like erotic blueprint. I don't know if that's something that you know about or have heard about, or there's this thing called erotic blueprint where there's different turn-ons for different people. And so it really is going to kind of depend on what is your turn on and turn off. I mean, that's huge, identifying your turn off. But having, again, just open communication. And this is something after 20 years of marriage with my husband that we're just now figuring out, is how to communicate and talk. But I mean, even having weekly dates where you check in with each other just over a cup of coffee and being like, okay, what's going really awesome? Like, these are what I appreciate about you. And really like loving up with words. That is a foreplay right there.
Yeah, I love that.
For it there. What can we work better on as a couple? So it's not like you're doing this wrong, but it's like, how can we improve and grow? And then also another bullet point is sex. Like, what's working, what's not? Maybe we're not even having sex, and maybe like, how can we ease into more intimacy even without intercourse? My husband and I used to call it IWI, intimacy without intercourse. And we'd be like, I mean, we don't normally say the word intercourse, but it was just a cute little a cute little way to say it. But IWI, that's really powerful, is have some IWI. You don't have to have sex to really feel that connection for both parties. And so you could bring that in even in your little weekly check-ins, is what's going great? What could we improve upon as a couple or individually? And then also, let's talk sex. Like, let's talk about it, because this is a really big part of intimacy, is a really big part of a relationship. And if you don't talk about it, resentment builds up on one or both parties, things build up, and it doesn't just go away. And so it's better to talk about it.
No, absolutely. I love that. I actually tell, which I'm going to bring that up, but I always tell my clients especially if I get to do a prenatal appointment, it's like, go ahead and have that conversation now before you get to the point where the hormones are raging, you're sleep deprived, you're trying to figure out feeding your baby, and then also trying to figure out how to communicate with your partner. Like, go ahead and have that conversation before you give birth, when you're well rested and you don't have somebody screaming at you or depending on you, of like, hey, I do better waking up in the middle of the night. You don't. It would be better if you could wake up in the morning first thing, give me a good 3-4 hour stretch, and then I will get up the rest of the night. Like having those conversations beforehand. You don't just have to have a verbal conversation. You can also do written notes. Text messages are great. ways to communicate. And I love having that one set aside of like, okay, it's Friday, it's 10 a.m. We're going to have our cup of coffee and we're going to have our conversation. Like that intention is so important. I love
The
that.
intention. And what I heard when I first learned this from a friend actually suggested this to me. And she said, make it separate from date night. And a lot of new moms aren't having date night yet. But if you do have a date once a month or once a week or whatever it is, that's not the time to talk about talk about anything you want to, but the date is meant to be more like fun and lighthearted and just like, oh, we get to be different people, not just at home with the baby. And so this is meant to be kind of a separate intentional time to really have a container to really focus on real talk. So I love that suggestion too, is making it, if possible, make it separate from a date.
No, that's a really, really good point. What if they're having any issues with intimacy? So like you had mentioned of it being painful, I hear that all the time. I actually use it as an example for pumping as well, because I'm like, hey, listen, nobody likes sex when it's not lubricated down there. And pumping is, also dry. And so put some lubrication on those pumps and you'll feel a lot better. But like, how would you go about that?
The biggest thing is training partners to and yourself to go slow and take your time. Hard in a life that's stressed and rushed because we have kiddos.
Yeah.
Totally admit this is not easy, but it's like when you're taking that intentional time for sex, because it's probably not going to be super wonderful to have a wham bam type of experience. Sometimes that's all you can do. And sometimes that's what has to happen. But oftentimes that's just not enough time for it to be comfortable, especially for a woman who's already got maybe low estrogen because of postpartum and breastfeeding. There's already some dryness. So definitely, of course, use lubrication that works for your body. But if possible, take time it can be helpful when you are touching your own body, that like vulva, like cupping your vulva, whatever you may be doing with yourself. If you are able to take a little time to just massage your vulva. The vulva is the outer area. It's not the inner vagina. It's the whole outside of your genital area. So touching and massaging that area really helps stimulate the whole erectile network. We know the clitoris is much more than just the little tip. It's also the huge erectile network on either side underneath your labia. So it puffs up with blood flow when it's stimulated slowly and for longer periods of time. And every time you increase blood flow to that area under the labia, on either side of the vagina, you're helping to bring circulation and health to your tissues, kind of plumping things up again. And it's so important for when you're touching yourself, but also for when your partner's touching you, just to naturally plump things up, naturally get the juices flowing. In addition to any lubrication you might add. So whenever possible, take your time just massaging the labia, stroking the labia, really taking your time with that, breathing, making it like a beautiful, beautiful experience with breath and touch for as long as you can. Even if it's just 5 minutes, that's better than 30 seconds.
Absolutely. Absolutely.
Well, and for partners to know that it's more than just touching that little button at the top of the clit. There's so much more. And they need, for me, it's actually the sides that's the most important part for me. The little button at the top is like nothing. It's the rest of it that is what matters for me. So educating our partners on that is really powerful.
We did talk a little bit about birth trauma or, past experiences. Trauma as a whole can affect the pelvic floor. That also can travel over to the intimacy aspect as well, right?
Yes, for sure. There's so much that we hold in our pelvic bowl. We always refer to it as the pelvic bowl, and many in my industry refer to it as the bowl. And bowls store things, just like a bowl that we put soup in, it stores soup. And our pelvic bowls store trauma. They store emotions. Stores history of things like birth trauma, birth injuries, the results of the changes and the grief of the changes, and then also past experiences of emotional or sexual, physical trauma, injuries, but also like sexual abuse, things like that. They're stored even as much as our first period, like how that was, how it was to have our first bleed. Was it scary? Was it celebrated? Was it ignored? Were we totally on our own? All these things, as kind of out there as it might sound, they store in the body. So that definitely impacts intimacy. And I think that's where, somatic practices can be really powerful in looking at what's held in the bowl and moving it through movement, breath, and sound with a practitioner, or, some of it you can definitely do on your own.
I feel like sometimes partners they think that they're connecting and doing something good by initiating intimacy, but if there's that trauma connected in that bowl, like you were talking about, that could be a really triggering issue for a lot of people. And I like how you said earlier that you're not broken with these feelings that you're having.
No, not at all. And your partner might be scared too, especially if there has been trauma or injury after childbirth. Your partner's probably scared. I know a lot of people with prolapse, pelvic organ prolapse, their partner they're not thinking it's gross or disgusting or anything. It's not that. It's that they're scared they're going to make it worse. And so just reassuring your partner that it's not actually going to make it worse. It's not. Now that I'm speaking of prolapse. For birth injuries, you have to be, very careful. And of course, healed. And that's a little bit of a different story. But I think oftentimes there is, again, just that communication of you communicating your needs to your partner. And also, if it's true at this point, if you're feeling that your partner's not going to hurt you through sex, communicating that with them too. So it's clear on both ends.
Yeah, I really like how you said that. I feel like this is a really great reminder for people everywhere that if you are in pain or if you're not enjoying sex, that's a good time to communicate with your partner. And if it's still not, if you've never had a good experience with, the pain level or just experience period, that's a great way to reach out to people like you in the industry, right?
For sure. Reasons to reach out. I think everyone should reach out to a pelvic floor physical therapist, like you go to the dentist. I just went to the dentist this morning and I'm like, I go every year without even questioning it. Why doesn't everybody go every year to a PT, even if they don't have issues, So I think it's a great idea for anyone, but especially if you have bladder leakage, if you're dealing with that urinary frequency, like you have to go all the time. If you have pain of any type, low back pain, hip pain, pelvic pain, painful sex, if you have that prolapse sensation, that bulging heaviness, like you have a golf ball in your vagina sensation, those are all reasons to go see somebody because there's help.
What happens if you go to your OB or midwife and you're like, hey, I'm experiencing XYZ, and they're like, this is just a normal part of childbirth, it'll get better, but you feel still like something is wrong. So is there like a possibility to find, like, where do people find people like you, or where could they work with you if that's a possibility?
Well, you just said my story. I love that. We did not set this up, folks.
We did not.
That's literally my story. And I was studying to be a pelvic floor PT, so I knew what was happening in my body. But like I had mentioned, I literally went for a run 3 weeks postpartum and developed prolapse because my body wasn't ready. And so my bladder prolapsed. I'm sure it had been kind of tentative before my run, but then the ligaments are weak. Everything's just kind of in a weird position and it just shifted down. And I felt this drop and I immediately turned around and went home because this was my work that I was training for. And I did a self-exam and I'm like, crud. And I went to my midwife who examined me. Actually, I think I went twice, and both times I was essentially blown off. That whole thing of don't worry about it, or it's nothing, I don't see anything. But for one thing, I was being examined lying down, not
so
in a normal
gravity.
I didn't have gravity pulling on anything, so I was not in a functional position. And so anyway, I mean, what I did is I created my own program. So I created my own program to exercise my muscles, my pelvic floor, and the rest of my body, because it all works together, and like use tools to live a pelvic floor safe life where you're learning how to manage your intra-abdominal pressure and lift things correctly, like your baby, because you're lifting your baby all day long. And so my program's not specifically like only for postpartum, but a lot of postpartum women have gone through it. So my program's called Lift, and it's an online program that you can do at home. Even if your provider is like, there's nothing wrong, if you know something's wrong, if you feel that change in sensation that's like, this isn't normal, that's when you can take matters into your own hands and trust yourself that there's help. And I mean, I have my Lift program for prolapse relief. I have another program called Overcome, which is for pelvic pain and tension. So it's really focused on relaxing the muscles and letting them go. And then of course, there's other physical therapists out there who you can see in person. And online courses, I just can speak to mine. But there's lots of options, even if your provider's like, it's no big deal, there's nothing wrong. Or another big one, well, let's give it a few more months and then get surgery. Just get surgery. And I'm not saying surgery is never an option, because sometimes it is the best option. But
Yeah.
if that's the first line of defense your provider gives you,
Mhm.
be careful.
Yeah,
You know?
absolutely. No, and
Yeah.
that's a really good point too, because I feel like a lot of, the medical world has become very industrialized into the fact of like, let's fix the problem instead of figuring out what's causing the problem. And that's a really great example of that, of like, yeah, the surgery could definitely fix it, but if we could come down to the root of it and support the root of the problem, you could prevent surgery, which is invasive and hard on your body and all those things. But sometimes you do need the surgery, and there's nothing wrong with that.
Absolutely. In some
Yeah.
cases, especially with birth injury, like a levator avulsion, when the muscle literally comes away from the bone. I mean, there's situations where all the exercises in the world may not fix things. However, that being said, even when an issue is severe, such as levator avulsion, so the muscle comes away, tears away from the bone, even in those situations, it can still be helpful to see a pelvic floor physical therapist or to do a program like my Lift program. Because even though it may not, your issues or your symptoms, it's going to help you learn how to live a pelvic floor safe life, which is going to help you going into surgery, and it's going to help the surgery stick and actually work, because it's actually quite common for surgeries to fail.
Yeah, and I actually like how you said that the pelvic floor life, because I went to pelvic floor therapy after my second. And one thing that just kind of like, I don't know why it didn't occur to me, but they were saying like, you'll use this for the rest of your life. And I was like, I thought this was just supposed to fix my issues. And they're like, no, it's meant for you to do these exercises like every day. And I was like, and I don't know why, but it just didn't click into my mind that it was like, I guess maybe because I think of physical therapy of like, with a broken bone or something like that, right? So you're just kind of like increasing your mobility, you're increasing your strength. And so I thought that was kind of going to be similar. But I mean, if you think about it, if you broke your arm, you're going through physical therapy. It's to the point so that you can use your arm every day of your life. And so you're still using your pelvic floor every day of your life. Like, I love that you said that. I love that.
Yeah, I love that you put it together like that. That's perfect. It is. It's your life. It's how you do pelvic health. You should be doing that for life, because it's just living a healthy life. Honestly, there's really nothing too magical about it. And it's usually not even a certain set of exercises. Again, how you're lifting things, how you're pushing and pulling things, how you're noticing symptoms and then taking care of yourself if they arise. And then like there's a whole set of tools that are more lifestyle tips than even exercises. So you don't have to feel like you have to do rehab exercises forever, but it's just becoming more aware of this part of your body and learning how to use it safely in everyday life. Because that way you don't have to go do a set of Kegels. You're kind of doing and incorporating like your pelvic floor into your every moment of your day. And so you don't have to do specific exercises for it, because you're always gently incorporating your pelvic floor health into your life.
Love that so much. They give me chills. If you could go back and tell your younger self one thing about breastfeeding, what would it be?
Breastfeeding is a loaded topic for so many people, and I myself included. I had a really hard experience with breastfeeding. This question, it makes me emotional, because it is it's for me, it's very charged. And I would say you don't have to repeat your mom's story, because I had grown up knowing how hard breastfeeding was for my mom and really how much she hated it. And I carried that with me into my own experience. And I wasn't able to do it for longer than, I think I breastfed for 4 to 6 weeks, and then I just couldn't do it anymore. And to me, I think kind of not knowing that I could write a different story, I could write a different reality. I know that now. If I could, and it's okay. Like I give myself, it's great that I even tried, and
and try. You did. I want to change your thoughts on that. Like you didn't just try breastfeeding. You did. Any amount of breastfeeding is you did breastfeeding, and you were successful at it. So, I'm going to give that to
I'm doing a little therapy right now. Because it's so emotional. I felt so much grief, and like I'd failed when I chose to give up on that aspect. So thank you. I did do it. And to anyone else, just rewriting the story, and just also knowing that you're doing the best you can no matter what.
Yeah, I love that. I tell my clients that all the time. I'm like, your worth as a mom is not dependent on how you feed your baby. That's just period. It is not part of motherhood. Thank you for sharing that. I know that's a really triggering question for some people, and I actually love that you were so vulnerable with that because, you know, so many people can relate to that 100%.
Yeah. Thank you for asking and just normalizing. I'm all about normalizing all conversation, even the stuff that makes you a little bit sad. It's in there. Obviously, that's still in there from 18 years ago.
Yeah.
So, you know what? Let's look at it.
And and just rewrite how you say that, because you didn't give up. You switched to what works best for you and your family, and you didn't fail. You did it, period. You know, so changing those little words, kind of like how I said with those audible of like sitting in front of a mirror, like your worth is not defined by that, and you did the things. Moms everywhere are freaking amazing. That's it. That's like the
mic drop right there. Mic drop.
Oh my gosh. Well, thank you so much for being here with us, Brienne. And for anybody watching, in the captions, we will have the links to her website and to all of the amazing resources that you were offering. Thank you again for being here.
Thank you. I really had fun.
I'm so glad.